Good morning. This is Sally Morgan, physical therapist, craniosacral therapist, and Tellington T-Touch practitioner for animals and people. This is Tristan. He's a Corgi, and we're here for an episode, he said something, of Conversations with a Corgi. And we're not at our normal time or day. It has been a chaotic week. I am out the door working by 8 every morning, and including today, I'm supposed to leave right after this. So I just don't have time to do these most of the time. So I am out the door this morning to see a dog with vestibular syndrome. And I've done this topic maybe 3 times, including today, but I think it bears talking about again because vestibular disease is common in older dogs, and it does cause panic in the pet owner because the dog will be staggering around. They might have a head tilt. You'll think they had a stroke. They might go up and down stairs or refuse to. Same with jumping on furniture. They're just not going to be themselves. And mostly we don't really understand this disease that much, I think, compared to vestibular disease in humans. One of the other things you'll notice with this is that your dogs will have nystagmus, which is an inability of the eye to focus. So it'll be like this, especially when they turn their head, and they will be reluctant to turn their head. And when I was thinking about doing this today, I thought, there's a benign paroxysmal positional syndrome in humans where you get a crystal in your ear canal, and it causes a lot of the same symptoms. And it strikes humans in their 55 and up years. And I think it has to do with kind of a chronic dehydration, buildup of gunk in the ear, etc., diet, different kinds of diet. And I'm wondering if there's not a similar things that happens with these dogs. But being dogs, generally vestibular disease will resolve itself in 48 hours from the significant symptoms. But it can recur. And, with the humans, to fix this crystal in your ear problem, you just have to rotate your head a certain way. It takes about 3 minutes to fix it. And symptoms as severe as nausea, vomiting, inability to walk, inability to sit up, inability to do anything, reading or looking at anything, even the television, all resolves almost instantly. With dogs, they don't do so much for this, and they just let it ease. So, that's what you'll notice if your dog is having this problem. And anybody who has a dog who has had vestibular disease can tell you, and it happens in cats too, that it is really scary to watch them because they just are circling, their heads tilted, they can't walk, they can't get up and down, they're very scared and nervous depending on their temperament. They may be unable to eat, they also may vomit. So the causes in dogs are often middle and inner ear infections. Often I see this in, spaniely type dogs, golden retrievers with the floppy ears that the people don't keep up on the cleaning, or just the dog has got a gunky ear. The dog I'm seeing today has ears like Tristan, they stick up. But part of it is as you're less active when you're older, the dogs aren't shaking their heads, running around, rolling in the grass, swimming and things like that might actually help move things out of the ear. So part of it's just the sedentary behavior of an older dog. So it can be ear infections. Also, some drugs can be toxic to the ear functions. Any kind of trauma or head injury, often tumors in the brain can cause this. And that's something your vet will want to check if your dog has vestibular syndrome symptoms. And then the other issue is hypothyroidism. That's not hyperthyroid, it's hypo. That's a slow thyroid. And again, that causes symptoms throughout the body in a lot of different organs, but this is one thing that can happen. Many cases, probably at least half of the ones I've seen are called idiopathic vestibular, and I've seen quite a few, maybe 50. And idiopathic just means we don't know where it comes from. There'll just be a sudden onset of symptoms and also rapid improvement without any medical intervention. But one of the medical interventions they do is put your dog on an IV and keep him still. They might tranquilize him to keep him from moving. CBD might be something you might give a dog with more minor symptoms, just to keep them calm and not in a state of panic that they're experiencing these symptoms, because we can't explain to them just lay down, don't walk much, I'll pick you up, don't go up and down the stairs, and in 2 days you'll feel better. So the CBD can help with that. They diagnose it by looking at the pet's medical history, how they're presenting. They might take blood and urine tests. Sometimes they'll take an x-ray. They might do a culture from the ear. One thing you can do as a pet owner right away is smell your dog's ears, and if there's a stinky smell, then you know there's probably an infection there, and that is treatable, and you want to bring your dog in. Sometimes they will do CAT scans and MRIs. If you're at a facility where that's available, it's very expensive. I'm not sure how pet insurance covers that for vestibular syndrome, but if they suspect a tumor, they might be more likely to cover it. And again, that's up to your vet, and that will depend on what the other symptoms are. Usually vestibular syndrome, like I said, occurs in older dogs. It's a sudden onset. It's not like, oh, you know, he's gradually been dragging one leg, or I've noticed he doesn't want to jump up anymore. You know, those could be back problems. Those could be a trip to the chiropractor or the acupuncturist. Usually with vestibular syndrome, there isn't necessarily a cause, but like I said, it could be an ear infection, toxicity to the ear from a drug, trauma. If your dog lives with some younger dogs that play really rough, he could have hit his head, gotten a little whiplash in his neck. In humans, when I see the symptoms, there's always a compression at the atlanto-occipital joint where the head meets the body. So I'm going to show you a couple things you can do with your dog just to resolve some of the issues that might cause. And then usually the symptoms resolve in a couple of days or even a few weeks. Like I said, they might treat them by putting them in the hospital or putting them on IV drugs, or also, you know, treating them with drugs for motion sickness. Again, CBD is going to be a good thing to give your dog for this. They have used steroids, but there's no evidence to support that helps. So if your vet's going to give you prednisone, say, I don't know about that. Let me check with Dr. Morgan, my sister, or someone else, or just say, let's hold off and see how he does. Dogs with vestibular syndrome usually get better. The severe symptoms resolve, like I said, in a couple of days. Usually they look completely normal in 2 to 3 weeks. Although there may be a little bit of a wobble in the gait or a head tilt for a long, long time. What's happened with the dog I'm seeing today, which is not as common, but I have seen this, severe symptoms 2 to 3 years ago. Dog's now 3 years older, I think near 15, and the symptoms are coming back. Not severe, but the dog is got a wobbly gait and a head tilt, and has had this for a couple of weeks, which is why a mutual friend suggested I go see this dog because they know that's the kind of thing I treat. So if this happens to your dog, there's a few things you can do. One of the first things you're going to want to do is get some space in between the head and the neck. And you can, there's what my mom calls the knowledge bump here. You can just put your thumb up against that and spread 2 fingers like this, or your thumb and your index finger if you've got a big dog, and you can feel the sides of C1. And just distract those, meaning you're going to take the thumb towards the nose and the other fingers towards the dog's tail. Really gently. I mean, you just want to hardly move the skin, and then just hold it for a few minutes. And if you do Reiki or animal body work of any kind, you might feel movement, or you might feel some heat coming out. Tristan had a pretty bad tumble in dog school on Wednesday, and I can definitely feel the left side of his head releasing a little bit more. He got tangled up in his leash and flipped on a concrete floor when he jumped up to try to scold a golden retriever puppy that was 6 feet away. Tristan. And the puppy had run to the end of his owner's leash trying to get Tristan because he wants to play with everything. And of course my dog looks like a bunny. And thank God that person's a very good retriever trainer. She's had lots of dogs. She had that leash wrapped around her hand like 17 times. And so when he went to the end of it, he wasn't going any further. She's a really good, responsible dog person. So you're going to want to do this, and I might want to work on this a little more later. You can see how he's turning his head. That's he's just sort of unraveling any of the restrictions that are in there. I'm just going to follow this dog going to his left ear, and he is 11. I mean, that's a little young for his vestibular syndrome, but You never know if your mom doesn't take care of you. So the other thing you can do, if you've looked at any of my T-Touch videos for the ears, if you haven't, definitely check them out. Ear work is good for travel, nausea, nervousness, behavior issues. I mean, T-Touch ear circles can be one of the best things you can do for your pet's health in 100 circumstances. If you don't know T-Touch, you can just kind of rub around the bottom of the ear, but with T-Touch, you're doing a circle and a quarter there. And there's a ton of acupuncture points here for respiration, digestion, and reproduction. So you're going to want to do that. If you can do the circles, great. If you can't, just rub around the base of the ear a little bit. It might be quite tight, especially on these stick-up breeds. It's often tight right here. And where the front of the ear, where it joins the head, because there's a muscle there to hold the little ears up. On the dogs with the droopier ears, you're going to find more tension right around the middle of the ear and here, because that's where the muscle's pulling to hold the ear on the dog. So after you've done some of these, you can see how much Tristan really likes this. You're just going to put your fingers inside the ear and just do T-Touch ear slides. So your thumb is sliding up the ear and your fingers are inside the ear. You don't want to snap it at the end. You want to just give it a little squeezy and then let go. Of course, if your dog's moving like mine, you have to really focus on not letting the ear snap like he just did to himself. So, and you're going to want to do this on both ears. Now in cranial work, I'm going to do this type of thing, but not the exact same thing with both ears at the same time. But there's so much potential to create a problem that I don't teach people to do that unless I'm really working with them for an extended period of time. So just these little ear slides, we call them, can really help your dog. It's going to help relax them if nothing else, but it definitely will help resolve some of the issues. Now, if your dog, excuse me, Tris, this is going to be a little weird. If your dog has this kind of ear, your ear slides are going to go down towards the floor. If he's standing, if he's laying down, you can do it, but you're going towards his feet. And if his ears stick up, you're going to follow the direction of the ear. So if you got a dog whose ears go up this way, you're going towards the ceiling. With a Corgi, they're going more out, so we're going sideways with the ear a little bit. And that's a couple of things you can do to help your dog if he has this problem. You know, just kind of even, you know, I would do circles all over his head. The trigeminal nerve comes out of the ears and basically goes where my three fingers are, to the eyes, the snout, and the mouth. And that can also be inflamed and create this problem. So I would definitely just, you know, rub the dog there or do T-Touch. T-Touch is way better. So look up that early video about ears. I think it's about number 32 in Conversations with a Corgi on YouTube. So that's a little bit about dog vestibular syndrome. I'm going off to see this pup, and I'm not making his person come to me. You know, with COVID, it's also complicated. But, and the dog doesn't travel well. So, and they're quite nearby. So everybody have a great day. Next week on Tuesday, so far, it's looking good to be able to do Conversations with a Corgi. So I'll see you then. Everybody have a great day. So nice to see so many of you. I think doing it a little earlier, I caught a few people left over after my sister. Thanks for joining us. Have a great day. We'll see you soon.